One of the most common changes is lumps in your breast. Sometimes the lump is really visible. Sometimes you will only be able to feel the breast. This is why self-examination is about feeling and about looking. My name is Marlies. I'm the Senior Manager of the Academic and Training Affairs in Fakeeh University Hospital and Breast Cancer Awareness Advocate. During the October Pink Month, we are empowering every woman and male to understand their breast health, to recognize changes and to seek professional help when needed. If we're talking about changes, what do I actually mean? There are a lot of changes in your breast that can happen. Every change is worth to be examined by a physician and to seek expert help. Let's have a closer look to some of the changes. One of the most common changes is lumps in your breast, the development of lumps in your breast. Sometimes the lump is really visible. Sometimes you will only be able to feel the breast. This is why self-examination is about feeling and about looking. What are other things that are common changes? A lot of changes can happen with the nipples. Maybe the nipple start to discharge some fluid. Fluid that is not like the milky kind of fluid, but fluid that is maybe a little bit more like honey. Okay, it is sticky and it has a certain discoloration as well. Other changes can be a crusty nipple, whereby the skin starts to flake. And this can also be crusty skin from the rest of the breast, not only the nipple. What are other changes that we see is the complete inversion of the nipple, whereby the nipple is being drawn inside the breast. This can happen with the nipple, but this can also happen in other parts of the breast. Another early sign can be the development of veins that are more towards the first layer of the skin. So you really see them, they are very good visible. This can happen during the pregnancy and then it will disappear after the pregnancy. But if this suddenly develops with you, this could be a reason for you to go and seek professional. Now we know what to look and to feel for, let us talk about when and how. Your monthly self-examination should be around the same time of the month. Preferably after your menstrual period, when your breasts are at ease and more soft. If you don't have a menstrual period, you can choose a day that you are easy to remember. All what you need is a mirror, a nice warm shower, and 15 minutes undisturbed time for yourself. You're going to stand in front of the mirror with your arms on the side of your body and you're just going to observe. You're going to look for any changes in your breast, any changes under your collarbone, any changes that you physically see, visible for you. You are going to repeat the same, but now you're going to place both arms behind your neck. When you're doing that, you lift up your breast a little bit, whereby you will see another part of your breast, and you are now able as well to look under your armpits and to see for any swelling under your armpit. Again, you observe your breast and you observe under your collarbone as well. Now we're going to go for our 2 times feeling. We're going to feel with the inner side of your fingers, 3 fingers in a row. And you're going to map your breast, almost as if you're going to follow the clock. So you start in a very soft motion at 12 o'clock and you are examining 1 o'clock, 2 o'clock, and you feel for any lumps, any bumps. After you finish the whole breast, you're going to do the same, but now you're going to give a little bit more pressure. In this way, you are reaching till half of your breast. And again, 1 o'clock, 2 o'clock, 3 o'clock, you're examining all the different hours around your breast. The 3rd time, you're going to really press deep. This is a little bit uncomfortable. When you're going to press deep, you're going to try to reach the back part of your tissue, almost towards your ribs. And you're really going to see if you can feel any lumps and bumps. This part was in a laying position, so that you're reaching the down part of your breast. In the last position, the standing position, you're going to take a nice warm shower, and you're going to repeat the same on your left and your right breast, both with soft pressure, mild pressure and deep pressure. After that, you're going to make little notes. What are the things that you are feeling, or do you notice any differences? These lumps and bumps that you're feeling are changing in size, in shape, or you feel that they are moving towards the other part of your breast, you're going to seek professional support. Breast health is not only for adults. Breast health starts on a young age. By educating our daughters and sons about normal breast health and empowering them with knowledge, this means that we are taking away fear and stigma, and that from a very young age, when there is an issue with the breast, people are okay in seeking medical attention. At Fakeeh University Hospital, we believe that empowering the youth in understanding their bodies will lead the future for prevention and not for reaction. When breast cancer is found early, treatment is simpler, recovery is faster, and survival rate is dramatically higher.